Hi, it's Dr. Sweeney here today to talk about upper limb problems from the hand through the wrist, elbow, and up into the shoulder and neck. Thought I'd just do a big combined video about common problems I see as a family doctor. Starting at the hands, I've done a wee video about this before. One of the most common hand problems can be carpal tunnel syndrome, which is compression of the median nerve, which runs here, supplying the thumb, these fingers, and this side of the fourth finger. And if you get compression of the median nerve, this can cause a numbness and a tingling. It can also lead to loss of muscle power and strength in this part of the hand as well. People often wake up with a numbness and a tingling, having to shake their hands. And so it's often treated by wrist splints, which hold the wrist in a certain position to relieve some of the discomfort, certain types of nerve pain relief, ultimately decompression surgery, where they can do a little incision here under a local anesthetic and can decompress the median nerve. So that is carpal tunnel syndrome. That's a common problem. The other part of the hand, so obviously you said this side's the carpal tunnel, the median nerve side, the little finger and this side of the fourth finger, that is supplied by the ulnar nerve, and the ulnar nerve actually runs, it's what we call the sort of, when we say we've hit the funny bone, so the ulnar nerve runs in a groove on the inside of the elbow here, all the way up to supply these fingers. If you have ulnar nerve compression, that can tend to cause a shooting or a numbness or a burning pain, which radiates down from this part of the elbow, shoots down to the fingers. Now, that can be often caused by sort of leaning on the inside of the elbow for lengthy periods. How do they treat that? If it's really bad and it's ongoing for a while, they can again go in and do decompression surgery. That would be an orthopedic surgeon that would undertake that, and can basically free the nerve up from the groove that it sits in. If it gets squashed, they can free it up. And again, that can relieve symptoms. Moving on up into the elbow as well. Moving on up into the elbow, common elbow problems are tennis elbow, which is lateral epicondylitis on this side of the elbow, and then medial epicondylitis, golfer's elbow on this side. These kind of epicondylitis problems, it's essentially, as far as I'm sort of concerned, a tightening or a shortening of the tendon in that area, sometimes often caused by overuse injury, stresses and strains, and it can be really debilitating. Over the kind of lateral epicondyle where tennis elbow happens, there is actually a kind of radial joint here, a sort of circular joint at the head of the radius bone, and the tendon sort of overlies that, and that can become tightened and shortened and can create a real discomfort when you're sort of gripping or carrying heavy bags, when you're sort of working, when you're sort of screwing things in or doing DIY. We often see it in a lot of manual workers that work with their hands. Treatment for that is, well, used to always be with sort of steroid injection, but now it's predominantly physiotherapy. An exercise where with the palm down, you have a weight and you stretch out with your hand palm down, and it elongates and stretches out the tendon. So physiotherapy is the mainstay of treatment, along with obviously painkillers. So going up from the elbow into the shoulder, common shoulder problems are impingement syndrome, whereby you can get impingement as you bring your arm up. You can get impingement of the soft tissues as they try to slide under as you bring your arm up. So impingement syndrome is really common. That can cause a painful arc, so you can't get your hand or your arm above, a certain height. That can often be treated with physiotherapy, and also in steroid injection. You can get calcific tendinopathy, where you get little bits of calcium deposits on the tendons. This can cause a restricted range of movement and a lot of pain. This can be treated by orthopedic surgeons with injections, but also procedures where they can literally scrape or chip away the calcium deposits from the tendons. So moving a bit further up again, common problems that we see are a cervical nerve root radiculopathy. What does that mean in plain English? Well, it means that the nerve root, so from the spine, nerves come out in pairs, and the nerves that come out from the cervical spine actually supply all the way down to the fingers, And if we get nerve compression here, it can often cause a shooting pain with numbness or tingling going right the way down to the hand. So that's a sort of classic sign: numbness, tingling, shooting pain, burning pain from the neck right down to the hand. And again, that would mean that we should have some imaging of the cervical spine, usually an MRI, which would show the nerve roots, because it's often the nerve roots which are being squashed and causing a numbness or tingling, jangling all the way downwards from wherever the compression is. Again, how's that dealt with? Usually physio, nerve painkillers. Sometimes the neurosurgeons have to get involved and do a procedure through the front of the neck to decompress the nerve root compression. So that is really a quick run through of common problems I see as a GP, running from the hand all the way up through the different joints up to the neck. And there are neural and muscular problems and skeletal problems, and need a combination of treatments with physio, time, pain relief, and ultimately surgery and injections, etc. So yeah, hopefully if any of that information's been helpful, if you're having a problem with your hand all the way up to your neck in any respect, hope this has been helpful. And until next time, see you later.